What is chronic pelvic pain from PID? Chronic pelvic pain from pelvic inflammatory disease is a long-lasting discomfort in the lower abdomen or pelvic area that continues even after an initial infection has cleared. This pain primarily stems from scarring and damage to reproductive organs caused by the infection and the body's inflammatory response. Pelvic inflammatory disease is an infection affecting the female reproductive organs, such as the uterus, fallopian tubes, and ovaries. It is most commonly caused by sexually transmitted bacteria like chlamydia and gonorrhea. If left untreated or not adequately treated, PID can lead to inflammation and scarring of these organs. This scarring can cause ongoing irritation, nerve involvement, and adhesions, which are bands of scar tissue that contribute to persistent pelvic pain. This discomfort can last 4 months or even years after the initial infection has resolved. The pain associated with chronic pelvic pain from PID arises from tissue damage and scarring in the fallopian tubes, uterus, and surrounding pelvic structures. Symptoms are often described as dull, aching, or sharp pain in the lower abdomen or pelvis. This pain may worsen with movement, during sexual intercourse, or during menstruation. Chronic pelvic pain can significantly impact quality of life and may be accompanied by other symptoms, such as painful periods or discomfort during sex. There is a notable connection between chronic pelvic pain and fertility. The scarring and damage from PID not only cause pain but also increase the risk of infertility. This occurs because the fallopian tubes can become blocked or damaged, preventing fertilized eggs from reaching the uterus. PID is recognized as a leading cause of tubal infertility and raises the risk of ectopic pregnancy, where the embryo implants outside the uterus, which can be life-threatening. Diagnosis of chronic pelvic pain from PID typically involves a clinical evaluation, pelvic examination, and sometimes imaging to assess the extent of any damage. Management focuses on alleviating pain and preventing further infections. While antibiotics can treat the initial infection, chronic pain often requires additional strategies, such as pain management techniques, physical therapy, or surgery in severe cases. From the perspective of fertility and endometriosis, chronic pelvic pain from PID shares symptoms with endometriosis, such as pelvic pain and painful intercourse. However, the underlying causes differ. PID pain results from infection-induced scarring, while endometriosis involves the growth of tissue similar to the lining of the uterus outside the uterus. Both conditions can affect fertility, making accurate diagnosis and tailored treatment essential. In summary, chronic pelvic pain from PID is a persistent pain condition caused by infection-related scarring of pelvic reproductive organs. This condition has significant implications for fertility and overall quality of life. Early diagnosis and treatment of PID are crucial to reduce the risk of chronic pain and infertility. Always consult a healthcare professional for personalized medical advice regarding any concerns.